Transfer with gait belt. Wash hands first. Knock. Hi, Miss Jones, I'm here to get you from your bed to your wheelchair. Okay, and make sure you're the right person. I'll be right back. Get my supplies, a gait belt, and a wheelchair. So I have a gait belt here, and the wheelchair is there. It's usually placed closer to the bed. So I wash my hands again. Come back. So Miss Jones, I'm back to help you out of your bed. I'm going to give you some privacy first. Okay. So we're going to take the pedals off the wheelchair first for safety. Open the brakes. Open right here. Flip it up. Take it off. You can rest them on the table. Remove the second footrest or pedal off. Open. Release. Okay. Down. Now we're going to make sure the chair is close to the bed, but first we're going to help the resident to sit. Help her to sit up. So we're going to raise his head of the bed up. Don't need to raise the bed, just the head. Head up. Don't want that pedal to fall off on her, on your resident, so I just fixed it. Okay, Miss Jones, so I'm raising your head up. Here we go, Miss Jones. And come around. I'm going to help you to have your legs over the side of the bed. So I'm going to assist you gently over. I'm going to ask you to sit forward a little bit for me. Thank you. Make sure I'm going to put your shoes on because the shoes must be on for this skill. So you should be able to put the resident shoes on. The resident is not supposed to help. So you are going to do it yourself. Okay, so we're going to get the shoes on. So you will have your white laced up shoes, which will be easier to put on and off. I'm going to put the second shoe on. Now you must have the shoe on before both shoes on before you do the transfer. That's for safety. So the resident should be wearing non-skid shoes to prevent falls. And the shoes must be on. Okay. Secure to the feet. Okay, so now we're going to make sure the brakes are locked. And the wheelchair is close to the bed at an angle. Now we're going to apply the gait belt. Miss Jones, please raise your arms up for me. I'm going to bend my legs. Put the gait belt on. Should not be twisted in the back. Going to make sure it fits her. So adjust the gait belt to the resident size. Make sure it's not too tight, not too loose. Tug it in, tuck the end in. Shouldn't be hanging down. You can put your arms down now, Miss Jones. And I'm going to hold the gait belt to transfer you to your chair with a pivot technique. So hold the gait belt to both sides and get her over to the bed. You release, remove the gait belt. Okay, Miss Jones, don't pull it, don't drag it fast to bruise her skin. Remove it gently. And just put it over there. Now you're gonna put the foot pedals back on, and they should face the correct way. There's a right one and there's a left one. The pedals should face inwards towards the resident. Don't put them on backwards, because this is where the resident feet are going to be rested. So not backwards. Pedals inwards. Open the brakes. Make sure the groove fits top to bottom. They fit right in there. Then close it. Close the pedal. Put her foot up. So this you need practice to do, to put the pedals on and off, because sometimes it's a bit challenging. Open right here. Let it fall in the groove on top and the groove at the bottom. Then put her foot on the brake, on the pedals. Open the brakes. Mr. Jones, you can watch TV. What programs do you like? Okay, there's a nice TV program going on. She wants to watch it. So what we're gonna, so the skill, this is the basic steps of the skill, but to make sure you have a nice finish, caring for the resident environment as well, lower this bed. And just fix this bed nice. If you forget this part, it's not a big thing, but you will create a good impression if this part is done. And so the tester is going to say, you really care about this resident. You're not just doing the task. You make sure her bed is nice and neat, looking good before you actually leave. Okay, so now we're going to put the gate bed back where you found it. Usually on top there. Remove privacy. Give her the call light. If you need it, just give me a call. I'll be right back. Okay, Miss Jones. Wash my hands. Skill complete.